in the world, with the possible exception of Finland, who do very well, are absolutely appalling at diagnosing and treating asthma. So I am not coming to Ukraine, and thank you very much for inviting me, to tell you off and say how wonderful other people are at treating asthma. We are all absolutely abysmal at it. Right, the definition of asthma is very simple, but we could argue about it for hours. It is variable respiratory symptoms of wheeze, tightness of the chest and cough, and this is the important bit, variable airflow limitation. Sometimes you can measure it, certainly in children over 5 or 6, but sometimes you can't. So, I want to go through the things that we as doctors all do wrong. We underdiagnose asthma, we overdiagnose asthma, we fail to ask the right questions, the treatments are really good but are never taken. If we now talk about underdiagnosis and overdiagnosis, this was a study from Canada, or a review from Canada rather. This looked at, for example, Danish young adolescents. They noted asthma in about 40%, but in a large number they were undiagnosed, and only 1/3 of these children had reported symptoms to their general practitioner. If you look in another country, Holland, they looked at more than 1,500 7 to 10-year-olds. 8% had undiagnosed asthma, and 5% had diagnosed asthma. So even in these countries with lots and lots of facilities and opportunities to make the diagnosis, we still don't do it. If you look at what I regard as a very important study, because this involves Ukraine, you need to look at this quite carefully because it goes over several slides. This is the childhood asthma prevalence and risk factors in Belarus, Ukraine, and Poland. Now, they looked at 4,000 children in each country, Ukraine, Poland, and Belarus. They were aged 7 to 14 years, so you could measure airflow limitation. 50% were deliberately chosen from rural environments and 50% from cities, and the 3 cities were Ternopil, Katowice, and Grodno. They are very close together. And given the history of this part of the world, there's been so much movement of people, everybody is the same. If you look, and the table goes all the same way, with Ukraine first, of course, Poland, and then Belarus, you will see that in Ukraine and Belarus, the percent of diagnoses with asthma is far less than the diagnosis in Poland, or Katowice, which is just next door. However, there is this other condition called spastic bronchitis, which I have never heard of before. You can see the diagnosis rates in Ukraine and Belarus is much higher than in Poland. And if you add the two together, they come to exactly the same amount. If you look at the incidence of wheeze in the past year and a diagnosis, you will find that in Poland, you are 3 times more likely to have wheeze and a diagnosis of asthma than either in Ukraine or Belarus. And in the ratio of children with current wheeze to a previous diagnosis of asthma is enormously higher in Ukraine and Belarus, especially outside the cities, compared to Katowice in Poland. So there clearly is a diagnostic question. I only learnt yesterday that I am told that there is a standard tradition, at least in Ukraine, that anybody who coughs on a regular basis is due to worms. If that is correct, I have never seen it, but I suppose if I wait 1,000 years, I might. I decided to look up spastic bronchitis in PubMed. You all know PubMed, it's the sort of standard summary of all the abstracts you can read over the last 60 or 70 years. There are 99 references to spastic bronchitis since the end of the Second World War, one of which is written in English. The rest are in a multiple of languages, especially Polish. If you look at asthma in comparison, there has been 76,500 articles with asthma in the title. It is quite likely that what is being called spastic bronchitis is in fact asthma, and they are therefore not getting the correct treatment. So, overdiagnosis is just a bigger problem as underdiagnosis, and they looked at, in Canada, 203 9 to 12-year-old children, and 102 of the 203 had a parent-reported, and that's a key word, parent-reported, physician-diagnosed asthma. 88 of the 102 were diagnosed as asthmatic by the study physician, but 35 of the 88 had no evidence of reversible airflow limitation or airway hyperresponsiveness. Airway hyperresponsiveness is not asthma, but if you have no reversible airflow limitation, then it is very unlikely you have asthma. Of course, there are incentives to have a diagnosis of asthma, and for those of you lucky enough to live in Norway, they have the behandlingsreiser, which means that asthmatics are sent for 2 weeks every year on holiday to the Canary Islands. And if that isn't a motivation to have a diagnosis of asthma, and I may say the holiday is free, then I don't know what is. Isolated chronic cough is rarely asthma. It is also very, very, very rarely due to worms. If you look at admittedly young children, and this was a study from Australia in 2006, they looked at 108 children referred to a tertiary centre at the mean age of 2.5. And the range was between 1.5 to about 7. And they'd had a cough for greater than 3 weeks. And it was fully investigated, including bronchoscopy and all the usual bits and pieces. Before investigation, 50% had a diagnosis of asthma, and after investigation, about the same number had a diagnosis of bacterial bronchitis. My definition of persistent bacterial bronchitis is a well child with a wet cough and all the tests are negative. 5% had asthma. So you see, we can't diagnose it, we either underdo it or overdo it. So, is asthma overdiagnosed? Well, of course it is. You must have evidence of airflow obstruction, and trials of treatment to see if it helps has to be short and focused, so you stop after 4 to 6 weeks and see what happens. because in a lot of children, the symptoms won't come back. And in the relatively few number of asthmatics, they will. We fail to ask the right questions. Sweden, which is generally regarded as having one of the best healthcare systems in the world, even allowing for the joys of Finland, they looked at primary care and examined all the key indicators that the national Swedish healthcare system insists are always done. And this looks at the history, looking at allergy, family history, cigarette smoking, furry pets at home, the indoor environment, is it damp or moldy? They also looked at clinical examination with spirometry, peak flow if you're over 4, or allergy tests. And they also looked whether inhaled steroids had been prescribed, short-acting beta agonists had been prescribed, acute nebulization in the clinic for acute treatment, plus, of course, patient and family education. They found that the number of medical records for children with asthma that included the various details was very poor. Only 55% had a family history, only 14% recorded whether they smoked or not, etc., etc., and only 30% showed whether they had a furry pet at home. You can also see that there was very little difference whether or not there was an asthma nurse in clinic. You can also see that inhaled prescription of corticosteroids was equally poor. So even in a very well-run healthcare system, we fail to ask the right questions, we fail to write them down. Even a spirometry, and a spirometer was available in every primary care practice, it was actually only done on 14% of the asthmatics, which is terrible. And this is Sweden. And I wonder why. If this was cancer, there would be a national scandal. But because it's asthma and everybody goes, oh, well, it's just asthma, it's regarded as a trivial disease. Loads of people have it, and it might be a social class dependent thing. And what is the end result? Well, in England and Wales, we regularly lose between 13 and 20 children a year dying from asthma, and about 1,200 adults die per year in England and Wales from asthma. So, the treatments are good, but are not taken. I hope this works. For those of you who ever watch television and have seen the program House, the greatest thing that was ever said on television is as follows. There's no sound on this. Wake up. There's no sound.
That everybody lies. The only variable is about what.
So, remember, when somebody comes to clinic, everybody lies. And that is true. Most of our severe asthmatics in our tertiary difficult asthma clinic lie routinely. We have the largest difficult asthma clinic in Europe, and we have a huge problem with fabricated illness and social chaos. One example is this. This was a study from our department and others looking at electronic monitoring of adherence to inhaled steroids. You use one of these type devices which times when it was used and how many puffs were taken. You will see, and I'm sure there's a pointer on here somewhere. Yes. You will see that in those who had 100% prescription uptake, adherence actually varied from about 25% to 100%. So even though the medication is at home, even though they've been educated until our heads drop off, they still don't take the treatment. 80% is defined, or above 80% is defined as taking the correct treatment the right amount of time. Remember, this study was done in difficult asthmatics who had been to intensive care. This wasn't just a bit of occasional cough and wheeze. These were really seriously ill people. And you can see how terrible the adherence rate is. 60% is counted as moderate and less than 60% as poor. Even if it is taken, and this is a study from Ireland in adults, they attached a microphone to the inhaler in order to check whether it was actually being done correctly. And they found on average that if you just look at the number of doses taken, you got an average of about 84%, but actually the correct adherence was about 60%. So we have to ask ourselves, why is treatment done so badly? You will have heard, of course, from earlier talks that we are supposed to be more sharing between doctor and family in how these things are decided. This is something, bearing in mind I am very old, that I completely disagree with because it has been a total failure. There are numerous reasons. Social chaos, for which electronic reminders may help. If you put too much expectation on a child, it won't work. As you go further east in Europe, I have found that there is an increasing fear of the use of steroids, and it doesn't matter what you do with that, electronic reminders will not help. Remember, a lack of education. Remember, education does not equal intelligence. Going to university does not make you intelligent, it just makes you educated. And also a lack of education about asthma. People consider it a trivial disease. You have seen this already. This is a study looking at the average percent of responsibility in taking inhalers. And you can see, obviously, as the child's age increases, the responsibility rises and it reaches about 50% around the 10 or 11 year mark. My wife tells me that I am not to be trusted to tie my own shoelaces, and I am 61. So expecting a child of 11 to take their inhalers on their own is complete madness. In looking at electronic reminders, this was done in New Zealand, where they took 6 to 15-year-old asthmatics who had attended the main hospital in Auckland on regular inhaled steroids to randomly receive electronic monitoring with or without an audio-visual reminder function. And what they found, of course, is that if you were reminded, and those are in blue, that your adherence went up. However, and this was those who just had the counter without the reminder. But you can still see that even with the reminder, there were still plenty of people, not taking the treatment. So, before you all go off at a tangent and think about all sorts of fancy ways of trying to achieve the impossible, you must get the diagnosis right, You must deal with the basics first. You must find out whether they're taking the inhaler, and asking the family whether they are taking the inhaler is not the way to do it, because they'll all go, "Oh, yes, doctor." I regard problem asthma as a social disease in which social intervention and indeed the courts are required to intervene. In our clinic, which I am told is the largest clinic in Europe, we have almost nobody on Xolair treatment because they don't need it. You may need a hospital admission. However, despite all this, we may still be just wasting our time. I hope I haven't wasted yours. Thank you very much.